Welcome back to Community Health Heroes. March is Colorectal Cancer Awareness Month. Did you know that approximately 5% or 1 in 20 Americans will be diagnosed with cancer of the colon or rectum in their lifetime? Joining us today to discuss the warning signs and prevention and treatment of colorectal cancer is Dr. Vivek Huilgol of NOLA Gastro. Welcome to the show, Dr. Huilgol.
Thank you so much.
So can you tell us what exactly is colorectal cancer?
Colorectal cancer is when abnormal growth occurs in the colon or rectum, and largely we're talking about adenocarcinoma, which is the cancers that arise from the glands that lie naturally within the colon. The problem is that it's incredibly common. And so our concern lies in trying to prevent it as much as possible. But colon cancer itself represents either a failure of the body's normal growth stopping mechanisms to take place or an activation of growth occurring problems at the genetic level.
And so what kind of signs and symptoms could a patient expect?
Well, most often, early on, there are no symptoms at all, which is why it's so important to get screening. And screening is really when you do a procedure when there are no symptoms. But by the time symptoms occur, the kinds of things that tend to occur are perhaps a change in bowel habit towards constipation. There may or may not be any bleeding going on. There may be a change in the stool itself, its size or shape or frequency or difficulty, perhaps some abdominal pain. If you're getting an abnormal loss of weight in conjunction with these things, that certainly warrants investigation. Unexplained anemia, a low blood count, and that of course goes along often with a sense of fatigue. I think as people generally are getting a little bit older, they perhaps blame some of their fatigue on age, whereas they really should be looking for another cause. So most of us are vibrant and healthy now in the 50 plus age group. So
you were talking about prevention. Is colon cancer preventable?
Colon cancer is largely preventable. I mean, I think that all of us in the gastroenterology community wish that it was 100% preventable. The best tool that we have at this time is colonoscopy. There are some adjunct tools that can be done. There are some stool tests that look for either the presence of blood or other DNA, fairly sophisticated tests. But on a practical basis, colonoscopy is the way to go. People often ask me, well, what about a CAT scan? And there are really two answers to that, and that is that in order to get the best possible CAT scan results, you still need to have the bowel prep, which is the reason most people are reluctant to undergo colonoscopy. The other is of course the radiation that goes with a CAT scan. But finally, if they find something, you still have to have the colonoscopy. So really, colonoscopy is our single best tool. It's a flexible tube. We are able to look on a large TV screen. It's a very magnified view. Take our time, look carefully. And the delightful thing is that most abnormalities that are going to turn into colon cancer manifest as little mushroom-shaped or tiny little polyps, P-O-L-Y-P-S, polyps, that are growing on the side of the wall of the colon. And we can remove them satisfactorily with a cautery device, send them to the pathologist, make sure there's nothing else going on. And because of the advent of frequent colonoscopy, we're now seeing a reduction in the numbers of colon cancers occurring nationwide. But it's prudent to undergo screening.
How prevalent is colon cancer in Louisiana compared to other states?
Actually, I don't know the statewide statistics. What I do know is that colon cancer is more common in the African American community. And I think because of our population demographics here, particularly in the greater New Orleans area, for example, but probably applicable to most of southern Louisiana or most of Louisiana, with a slightly higher percentage of African American people than, say, perhaps in the Pacific Northwest, to take a completely opposite example. It is going to be a little bit more common, and we think that colonoscopy should begin at age 45 for people of African American descent, whereas it's really 50 in the Caucasian population. There are some conditions that make you at greater risk for colon cancer, and the very obvious one is if someone else in your family has had it. There are some other rarer genetic conditions. People of Eastern European Jewish descent, the Ashkenazi Jews, actually have a much more common genetic abnormality that predisposes them to colon cancer as well. So people that are either Ashkenazi Jew or African American or have that family history of colon cancer certainly need to have a discussion with their physician early on and initiate screening in one way or another fairly soon.
And if you're a normal, healthy person without the family or the hereditary risk, how often should you have a colonoscopy?
Well, all of the national bodies that make recommendations in this area say that start at age 50. And one of the things I've done in my own career and have seen, at different places that I've worked over the years, is that if you're over 50 and you're otherwise healthy and you have a relationship with your primary care doctor, call us up. We'll be happy to schedule a colonoscopy for you. You don't need the two-hit of coming to the office and kind of just going over, hey, I'm healthy, I need a colonoscopy. We're happy to do that. In fact, if you should see any gastroenterologist. If you come to my practice in particular, we run an open access feature. You can find that on our website at NOLAGastro.com.
Now, do certain foods lead towards colon cancer, or dietary restrictions?
Yeah,
colon
good
cancer?
question. I think that the data is fairly clear that if you eat a lot of red meat or a lot of processed meat, so that those do have an increased risk for colon cancer. We know that smoking is another definite risk factor for colon cancer. And unfortunately, the data is pretty clear. If you're sedentary or overweight, you are at greater risk for colon cancer. So those are, it's all about diet and exercise. If you're not, keeping yourself in good shape and exercising regularly, being sedentary in of itself raises your risk for colon cancer. Smoking, something else that is under your control. Diet, a little bit trickier to tease out, but there certainly does seem to be a relationship with lots of red meat or processed meats.
Like processed meats like sausages and bacon?
Absolutely, yeah.
Lunch meats kind of stuff?
Lunch meats, sausages, in particular. And I suspect, might relate to nitrites or nitrates within the processed meats.
And if our audience wanted to know more about colon cancer and prevention, where would they go to find that information?
There is such a wealth of data out there on colon cancer now. Certainly you can go to Google and enter colon cancer and you'll get a wealth of information. I particularly like the data that's at the American Cancer Society. The ACS has a wonderful detailed explanation on colon cancer. They've got a simplified guide to it, a more detailed guide to it. There are organizations, the Colon Cancer Alliance, that is specifically geared towards people. That tends to be obviously people who have had a diagnosis of colon cancer made, but if you're interested in prevention, speak to your physician, speak to a gastroenterologist, come see me, come see any one of the fine GIs. In this town, there's a lot of good gastroenterologists here. And
recently there have been some infections associated with colonoscopies or some type of scope. Can you tell us a little bit about that?
Good question. So colonoscopy itself has not been the culprit, and neither has conventional upper endoscopy. There are some very specific tools. It's a side viewing duodenoscope that's used for a very specific procedure to look at the bile duct. And it is alarming that, with the use of these therapeutic ERCP scopes being used and cleaned appropriately, that there are still some instances of transmitted infection.
So it's not with the upper endoscopy or the colonoscopy. It's actually a special scope that's used for a special procedure that has been associated with some of these infections.
Yes, and there's no doubt that this risk exists. If you look, however, the use of the ERCP scope in large part avoids the need for very invasive surgery of the bile duct. And so it's one of those things where I think it's very unfortunate. There are now some new guidelines that are emerging as to how to improve even therapeutic scope cleaning, but it does not apply to EGD, upper scopes, nor colonoscopes.
Well, thank you for this information. I really appreciate you being on our show today.
Well, thank you very much for the opportunity. I appreciate it.
You're welcome. When we return, we'll be speaking with Molly Kimball, Nutrition Program Manager, Ochsner's Elmwood Fitness Center, who will give us an update on their successful Eat Fit NOLA program. So don't go away. We'll be right back with more Community Health Heroes.